Good afternoon. My name is Dawn LaPrette, and I'm a program manager at the Chicago Council for Science and Technology. Welcome to the launch of our new series on mental wellness and to today's program, Mental Health, Bias and Collective Trauma. We are happy to bring you this program in partnership with the School of Social Work at the University of Illinois. The Chicago Council on Science and Technology is a 14-year-old organization with the mission to bring an awareness of science and technology to the public. If you would like to learn more about C2ST, please visit our website. You may also consider donating to C2ST via our Kindful link. And during the broadcast, you are welcome to ask questions during the broadcast, at c2st.cnf.io. So let me get down to business regarding our program. We will have a presentation from our speakers, and at the end of the program, we will have an opportunity for you to ask questions and have them answered by our experts. Our first doctor joining us today is Tara Powell. She is an associate professor in social work at the University of Illinois, and her research explores the impact of post-disaster behavioral health, the interventions in disaster-affected communities, both in the United States and globally. She began her career as a clinical social worker in New Orleans after Hurricane Katrina. And as both a hurricane survivor and a post disaster services provider, Dr. Powell recognizes the need for behavioral health programs to address the emotional toll of collective trauma, such as the pandemic. Karen Tabb is also an associate professor in social work at the University of Illinois. Her current research focuses on the social determinants of health and mental health outcomes for pregnant and postpartum women. She conducts research in racially and ethnically diverse public health clinics to screen perinatal women for psychosocial risks during pregnancy. Both women have responded to the COVID-19 pandemic, providing webinars for self-care and providing expertise on stress management and coping skills. We are very grateful to have them with us today. And again, to ask questions during the broadcast, you can go to c2st.cnf.io. And without further ado, let's hear from our experts. Welcome, Dr. Powell and Dr. Tabb.
Great. Thank you so much for having us. Really excited to be here today. So I do believe we are going to go ahead and start sharing a PowerPoint that we have today. Karen, would you like to introduce yourself anymore? Or are you all ready? Already. Okay, great. Okay, so today what we will be talking about is we will be talking about, as Dawn mentioned, um, the COVID-19 pandemic, mental health, and all of the issues surrounding mental health during the pandemic. There's been a lot going on, so we'll talk about coping with bias and also collective trauma. We can go to the next slide, please. Yep, the next one after that. Okay.
Let's see.
Technology is always fun. Oh, I can control my own slides. Okay. Great.
Okay.
Just 1 second. Well, I will go ahead and pull my slides up and control my own. Okay. It's just going to take 1 minute. I'm just going to unshare my slides really quick and I'm going to share those back again. Okay, well, I'm having a little bit of a problem with my slides because one of my monitors went down. So I actually am just going to go ahead and start without my slides. I will share the ones that I've got and we'll go from there. So always dealing with technology can be kind of challenging. So what we are going to do today is, again, we are going to talk about stress and coping. And so I would like to start is I would just like to start with a grounding breath. So a grounding breath can bring us back to the present, can get us relaxed when we're feeling really stressed out, can get us back to the awareness and enjoyment of everything that's going on. So everybody get comfortable in your chairs. And if you can take a deep breath in and breath out. And then take a deep breath in and notice all the sights and sounds around you and breath out. And a deep breath in. Notice how comfortable you are against your chair. Notice your back against the chair. And then breath out. And then another deep breath in. Notice all the smells. Maybe you have good smells around. Maybe something's cooking or you have some coffee, afternoon coffee. And then breath out. And as we go through the next 50 minutes, we are going to talk quite a bit about stress and coping. And so a grounding breath is one thing that you can do when you're feeling a little bit stressed out to just bring you back to the present, to help you calm yourself and to help clear your mind. So I do want to go over the learning objectives today. And so what we are going to do is, first of all, we are going to talk about the cycle of mental health during collective traumas. Then we are going to talk about how bias influences all individuals. And we're going to talk about that in relation to the pandemic. And then we'll go ahead and share tangible coping strategies to enhance our well-being. So I want to talk a little bit about COVID-19 and stress. So I want to ask you all just to think to yourself, has anybody experienced stress during the pandemic? And I think most of us probably have. It's very normal. There's been so many stressors. So during COVID-19, there's stress around social isolation, stress around relationships, loneliness, fear. There's also community and national issues, separation from loved ones. And I know a lot of people are pretty stressed out with the quarantine, so quarantine fatigue. And that's something that, I think maybe one or two of us has felt before. The pandemic has lasted a year, and so it's lasted quite a while as of now. And so all these stressors, it's normal to have really common reactions to these. Sometimes people have a hard time sleeping. I've heard lots of people, worked with lots of people that say they have these very vivid dreams, which are totally normal because it's our mind's ability to make sense of the stressors that are going on. So in my work, with in post-disaster work, I've seen a lot of different reactions, and they're all really common. So some of those are depression, anxiety, um, post-traumatic stress disorder. And just one second, and I'm going to try to get my presentation screen going again because I've got a really good visual that I would love for you to see. Ah, there we go. There it is. Karen, do you have control now? Okay, great. Thank you. Thank you. All right, success. So we made we got through our technology challenges. Okay. So yeah, we can go to the next slide to the one on mental health. Okay. So yeah, so the next slide is just on it's on just talking about mental health and collective traumas. So as I said, stress, anxiety, depression, post-traumatic stress are all different types of reactions that people have. Another type of stress reaction that people have is fear. A lot of people can get angry, and those are all just really, really common reactions to abnormal events. So, I want to talk a little bit about then just what what the pandemic has looked like with mental health. So, what you'll see in the previous slide is that the mental health symptoms, so anxiety, depression, has went way up over the course of the pandemic. So, what we saw in May when the pandemic was just beginning was the average weekly symptoms of anxiety and depression were pretty high. They were at about 29%. But then when in July, and now we're all the way in uh, February, but they went all the way up to 35%. And, recent estimates have shown that these estimates continue to go up. So in the slide before, I have the mental health and COVID slide, but I want to show you what a typical disaster mental health cycle is. And so that actually is in the previous slide. Um, but we can actually just go, we can just go, we can just go to this one, stay on this mental health and COVID slide. So one thing that we know with disasters is there's a clear timeline in natural disasters. So, before the disaster, people are usually kind of in the middle with emotional highs and emotional lows. People are doing okay. And then when a disaster happens, there's a lot of stress. And, emotional lows go way down. But then there's this recovery phase, and communities begin to bond together. Ah, there we go. Thank you. Communities begin to bond together, and that's called this honeymoon and heroic phase. But then, as the recovery goes on, there's disillusionment. People get frustrated. People get tired. They get fatigued. They're just ready for the disaster to be over. And then after that, when the disaster is over, there happens to be this reconstruction phase. And people actually do a little bit better and during the reconstruction phase. And that phase is called post-traumatic growth or resilience. So resilience is the ability to bounce back after a traumatic event. And that happens often in the reconstruction phase. So in the next slide, I'm just going to talk a little bit about the COVID cycle. So, uh, what you can see is pre-COVID, we were kind of the same, kind of doing okay, kind of in the middle. Um, and then in about March of last year, what you saw there was a threat of COVID. Fear started happening. Cases started to rise. People started getting really, really frustrated and overwhelmed. But then in about April, communities started really bonding together. People were supporting healthcare workers. I know in one community, people would clap for the healthcare workers every day. Um, and so the communities were really bonding together, which was great. The difference between COVID and a natural disaster is COVID keeps going on. And there's been so many other issues that have happened in this past year, specifically in the United States. So as it's going on, we don't have a clear end, and we haven't as we've got to have the vaccine, and so recovery, looks like it is going to happen, so we can see an end in sight. But we're still kind of in the middle phase of it, so it lasts a lot longer, than a typical natural disaster. So different feelings that we can have grief, stress, fear, uncertainty. We're still in that disillusionment phase because it's lasting so long. And in addition to the COVID cycle that we have, there's also been social unrest. There's quarantine fatigue that I mentioned before, political challenges. Last year, there were a lot of natural disasters. And so all of these things have created just a lot of stress, which, is normal. We've had a stressful year in the United States. And so what Karen's going to talk a little bit about next is she's going to talk a bit about how bias influences us. And then I'm going to go after that and talk a bit about coping, because we want to share some strategies to help coping with these stressors that we have.
Thank you so much for the opportunity to join and to share as it pertains to mental health challenges that we are all facing right now during COVID-19. We know in our country that we've had a turbulent year, to say the least. We know that COVID-19 has been horrible on its own in terms of infection and transmission rates, but then the exacerbated disparities within COVID-19. We are seeing record numbers of mental health problems such as depression, anxiety, and suicidality, either attempts or thoughts during this period of COVID-19. And we're seeing record disparities for our racial and ethnic minority communities. Over the past year, we've come up with the term BIPOC, being Black, Indigenous, or other people of color, that have disproportionately experienced the brunt of COVID-19 and thus disproportionately experienced things like grief, trauma, and loss. If we look at the case of African American, Hispanic, Latino populations, if we look at the case of Asian Americans in this country, we see that these groups are more likely to disproportionately die from COVID-19 as opposed to European Americans. And there's loss and grief that is impacting our BIPOC communities faster and more widespread than in our traditional white or European American communities. Another thing that really set off this year that is a cause for stress, alarm, collective trauma is the notion of racial injustice in our country. This is not brand new. This is something that we've dealt with for over 400 years. But what was new to the situation of racial injustice in this country is the fact that so many of us were at home. So many of us were watching live the suffering and the loss of life from people like George Floyd, where we watched a 10-minute video online of a murder take place, Breonna Taylor, Aubrey. We can go down the list. There's so many people that have lost their lives at the situation of policing this year. This has been a pandemic within a pandemic, because we're all watching these videos and experiencing the trauma of watching really anomalies of people who are thought to protect and serve, and you're seeing the bad apples come out and do horrific things to Black people in this country. With this resurgence of attention, some call it the civil rights movement, we have hope, we have anger, we have fear, and we have stress that go along with the Black Lives Matter movement, with protests that took place in most every city in the United States. Fear for Black Americans who have the fear of the pandemic of COVID, but also the fear of living their lives safely, making it through each day safely. Maybe there's extenuating violence in the community, or if it's just getting through a store without facing discrimination. So we've had record stress for Black Americans and for all Americans who are living this, who might be witnessing and or thinking about racism for the first time. I've heard from a lot of our patient groups there's a need for some introspection. This relates to tackling implicit bias. So implicit bias is nothing new. It is the fears inside of our heads that we hold. And this might be unconscious to you, yourself. I know the first time I took an implicit bias test, I'm a Michigander, and I learned that I had some prejudice towards Canadians growing up in a border area. And this is not uncommon. And you might think, this is not me. I have friends. I have friends who are Canadian. But you learn of these implicit biases about yourself, of things that we've been programmed to hate or to fear. And it takes years to undo the work. So this year during COVID-19, we've seen a huge push to implicit bias, which is a stressor for many people. We've seen a tremendous amount of bias within the healthcare system, and that would be access to care. It would be treatment of care for those who are experiencing COVID-19 or other situations. We know that there are health disparities where groups who often faced a large amount of discrimination are also going to experience a disproportionate amount of health problems. Okay, those two go hand in hand, discrimination and health problems. And there are many reasons for that, many reasons around theories of how stress gets under the skin. A concrete example of how there's bias in the healthcare system and how it relates to COVID-19 is that healthcare workers face additional risk for contracting the virus, the COVID-19 virus. We know this. But if you start looking at the breakdown of healthcare workers and those who unfortunately aren't surviving the virus, we'll see there's disproportionality in terms of Asian American or nurses of Filipino background dying from the virus. And these are our frontline workers. These are our essential workers who are people of color, and they have more exposure to the virus and higher morbidity from the virus, and then the cascading effects, more grief, more loss, more trauma. So there are no quick summaries of what we're experiencing. We just know that COVID-19 in this country and throughout the world, this is a movement that's taking place in Canada and Brazil and Italy. Black Lives Matter has spread around the world as a beacon to highlight inequality and a call to action within the pandemic to make sure that we all make it through it and we do not suffer unequal accounts of the pandemic. This collective approach to injustice, collective attention to racial bias is adding to our stress of the virus. Those of you know that I study birth and what happens during birth, and I liken it to a birthing process. We are in a very intensive labor right now. We're laboring a baby, and we're going to have to birth this to get on the other side. So we're going to have to work through these issues of equity in the virus, discrimination in the virus, and our larger, broader issues around race and racism in this country. I think I've made you all so stressed from this very quick synopsis of what's going on with racial bias in this country. I'm going to turn it back to Dr. Powell to pick up with stress and how that's leaving us.
Okay, great. Thank you, Karen. If we can try to get the slides again, that would be great. Thank you. Okay, so the big question is, so Karen brought up, a lot of really relevant issues that have come in addition to the pandemic. There's so many things going on, in our country and around the world. Um, and so, the question, you know, regardless, no matter what you're feeling stressed about, if you're feeling stressed, is is it normal? Um, is it normal to feel stressed? We're all experiencing something, and the answer is yes. It's very normal. We're going through so many situations that have really taxed us in many ways. The uncertainty, the fear, um, changing our life as it is. So there's so many reasons, not having a new normal, but having an abnormal of what we're going through. So yes, it's very normal to feel stressed. So I want to talk a little bit about self-compassion. And then I'm going to go into some strategies some tangible strategies that you can use to be able to cope with some stressors. Some of them may be new, but some of them may be some things that you didn't think about before. So, one concept that I always love to talk about is self compassion. And self compassion is just such an important thing to have right now. So every time, always when I'm doing webinars, I ask people, how many of you are harder on yourselves than you would be on anybody else? How many of you have higher expectations for yourself than you would for somebody else? Or say things to yourself that you would never say to anybody else? So I know maybe one or two of us have that. Um, So what self-compassion is it's really just acting the same way towards yourself when you're having a difficult time, or notice something you don't like about yourself. And rather than ignoring your pain, just stopping and saying, hey, this is hard. How can I comfort and care for myself in this moment? Rather than telling yourself, oh, you have to keep going, you have to do all these things, expecting more of yourself than you would expect of a friend. If you had a friend going through a hard time, you might be there for them and listen to them and say, how can I support you? And what self-compassion is it's really supporting yourself and taking a minute and saying, hey, yeah, I'm actually going to support me. I'm going through a hard time, and it's okay. And it's normal, the feelings that I have. Um, and so I'm going to talk a little bit. So self-compassion is very important. And just one thing, I there's this wonderful self-compassion website that you can go to, and you can test your self-compassion. You can see how self-compassionate you are uh, towards yourself. And this is from Dr. Kristen Neff, and she's out of the University of Texas at Austin and has done really wonderful work within this concept of self compassion. Okay, so now I'm going to talk on the next slide just about some things that we can also expect after a collective trauma. So, one thing that we have to recognize and remember is we will heal. We're going through this collective event or events together. Sometimes it can feel really challenging. Sometimes you can feel overwhelming. But through hard times, that's how we grow resilience. So resilience is the ability to recover from and overcome a traumatic experience, and actually you can grow stronger after that. And that's what post-traumatic growth is. So after a really challenging time, really challenging situation that can really tax a lot of your senses, we actually grow and become a lot stronger. And then there's this other concept that happened that is really important to remember within disasters, and that's collective healing. And So that's when you talk to others, when you allow other people the opportunity to process events, to grieve, um, or to take action to help them heal. So there are different ways that we can cope with with mental health during COVID. And it's not only on the individual level, it's also on other levels. It's social support that's so important. Reaching out to others, finding a community, even if you can't talk to people face to face, finding a community where you feel safe, and this could be an online community where you have shared experiences, talking with each other about your shared experiences and learning from each other, asking, what other people do to cope, um, you know, learning strategies from other people, supporting each other. You know, if you see somebody is having a really hard day, just asking them, hey, I see you're having a really hard day. Do you need anything? Reaching out to others. So, you know, and just even via text easily saying, okay, well, my friend might be having a hard day. I just want to see how they're doing. And just practicing compassion. And so that's on really the more broader community level. On the individual level, one of the most important and first steps to take is normalizing the stress and recognizing it. So realizing, hey, like I'm feeling stressed. Um, you know, s- Stress affects us in so many different ways. It can affect our cognitive ability. So if you become forgetful, I don't know if anybody's become forgetful during the pandemic. That's happened to me once or twice. So we've got these cognitive, your memory might be bad. We've got these physical reactions. A lot of times when people are really stressed, they gain weight, or they lose weight. And it's not even necessarily from eating more or exercising less. Sometimes it's just our cortisol breaking down a little bit differently. So we've got these cognitive, these memory, our ability to remember. We've got these physical reactions. We've got these emotional reactions. So having really intense and unpredictable feelings is super common as well. So crying one day and just saying, I don't even know, or being angry, one day and realizing I'm really angry today and realizing, yeah, hey, I think it's because I'm stressed out and that's okay. That normalization is so important. Another thing we can do on the individual level is just practicing mindfulness. So at the beginning, I did that grounding breath, and that's just very, very quick way to practice mindfulness, just becoming aware of the present. So within mindfulness, another activity that I do in the morning, first thing, I'm able to do it more now because it's not as cold. It's still pretty cold, but taking a step outside if you can, or looking outside. One thing I do is I look outside, I open the window, and I just take a deep breath in and then see the nature around me, see the outside and welcome the day. And that's just a simple mindfulness activity that can really help reset, if you're starting the day feeling like, I don't want to get up. This is hard. I'm having a hard time. I don't, I'm feeling frustrated today. It can just bring you back to the present. As I mentioned, social support, and that's community, but also, reaching out to people on the individual level. If you need help, um, finding social supports and finding people who can help you in a positive way, and who can be there for you. And also, if you need to reach out to somebody for, a social worker or psychologist, if you're realizing, hey, I'm having a hard time, that's okay too. There's a lot of teletherapy that you can do now, that's available, which is great. That's one thing. There's been a lot of bad things and challenging things with the pandemic, but there's also been a lot of really good things. So then self-compassion, as I mentioned, healthy coping strategies, and I'm going to go into those next. And then voicing your needs or your boundaries. If you don't feel comfortable with something, letting somebody know, or letting, if you're overwhelmed at work, hey, I'm overwhelmed. Like, these are my boundaries. Or if you're overwhelmed, in a relationship, just voicing your boundaries within that is, we don't think about what that with self-care, but it's a really important, factor in self-care, is knowing what your boundaries are, and letting other people know. So these are some ways of coping. And then I'm going to have an exercise, that a tangible exercise that you can do that's always helped me. So we think about these different dimensions of how we react to stress. So there's the physical that I mentioned, there's that emotional, the cognitive stress, behavioral. There's also a spiritual sense. So sometimes people disconnect with their spiritual side, and that doesn't mean religion, but it's more a sense of purpose. It could be religion; it's whatever you identify with. And then there's the social. So physical, trying to relax, trying to get exercise, even if it's 5 minutes a day, going out and taking a 5-minute walk, uh, trying to get sleep. Emotional, meditation, reframing difficult situations. So sometimes things that we do, we might have negative self-talk. We might say things negative about a situation, or look at a situation difficult as it's or look at it in a difficult situation very negatively. So catching yourself in those thoughts and reframing them can be really, really, really helpful. Um, and then there's cognitive. So brainstorming ideas, even recognizing you're going through a hard time, writing down goals, brainstorming solutions to problems, just even, I always try to journal. I went through the other day, and I realized over the past 5 years, I've had about 40 journals, and I've only written about 2 pages in each of them. So I say journaling, and journaling can be a great thing. But if you're not a journaler, that's okay too. But even just writing solutions and saying, hey, what are these goals? What are things that I can do to make me feel better? Behavioral, trying to keep a healthy diet, and we hear that all the time. Spiritual could be connecting with your sense of purpose. Try and, again, that can be just trying to find a sense of meaning or purpose within yourself. And then social, so just reaching out to others or connecting with support systems. So after that, now I'm going to do an exercise with you all, and I'm just going to do this over a few minutes, because we want to take some time for you all to be able to share, or for you all to be able to answer questions. But I just want to ask this question. So, what are your ways of coping? And if you have a pen or a piece of paper, it'd be great to get it out and just take a minute. We'll just go a minute and have you write down, how do you cope right now? Just consider what you're doing. Okay, and maybe, I don't know if everybody had a chance to get out a piece of pen and paper, but hopefully you're able to write down one or two things. Um, but now, thinking about the ways you're coping, sometimes when and it doesn't have to be, coping is actually, it can be good or bad. We cope in the way we manage stress is the way we cope. So we can cope in bad ways, and that's okay. Just recognizing what you're doing and seeing, does this serve me? Can be really helpful to start thinking about how you can reframe your ways of coping to have it serve you well. So we're going to go to the next slide. And I want to share a plan, a self-care plan that can be extremely helpful. So, I the first time I did a self-care plan like this was back when I was 25. I had just went through Hurricane Katrina. I'd lost my house. I was super stressed, living in the sunroom of a friend's because all of the houses were flooded. And so I really needed that self care plan. That was a time where I realized, wait, I'm coping, but I don't think I'm coping so well. And so I went to this training, and they encouraged us to write a self care plan. And I've changed this quite a bit since I did my first one. But I looked back at my self care plan, uh, a couple years ago, and I realized, wow, I was able to actually do some of these things that I put down. And things have changed quite a bit since 2005. But, and I do different things, but some of them still were the same. So if you do have a pen and paper, um, I would encourage you just to take a minute and think about those different dimensions. So I talked about those different dimensions of stress, how we feel stressed physically, emotionally, socially, spiritually. There are these different ways that we experience stress, and then there are these different ways that we cope, and they all are interconnected. So, and they all encourage our overall well-being. So, within this, I would encourage you to take a minute just to write down, and it doesn't have to fit in every bubble. Some places of coping could be better for you than others. Um, but even just document physically, what can I do to keep myself physically healthy? Emotionally, what are small things I can do or say to keep me going? Environment. We're all spending a whole lot of time at home right now. And so, what is anything that's feasible and tangible that you can do to make your physical space more welcoming? Then there's spiritual. What are things that I can do to find meaning and joy in my daily activities? Intellectual or creative. What kind of creative projects can I do to keep my mind busy? And then social. Who are the people that help me socially? Who are my social supports? So, as you take a minute to write those down, I just want to share that, I've done a lot of self-care work with many people over the years. And oftentimes people have said, what's that one thing that I can do to be better? How do I cope? Um, and I always give the example of, well, one way that I cope is I like to run. And so if I told you to go out and run 10 miles, would you go run 10 miles? And people are always like, no way, no way. And I'm like, well, that's kind of an extreme example because I'm not really running 10 miles right now, but running a little bit. But so the reason I say this is because, you know, running can help me quite a bit, but it might not work for you. And so we all have our own individual strategies that work for us and that can really help us. And so that's why I really encourage the use of the self care plan because you can document, hey, what works for me? And so we'll just give a minute for that. Okay. So I did see one question earlier that asked about as you all finish this, that just asked about mindfulness and meditation and yoga. So there are so many wonderful breathing exercises that you can do. And actually, one of the questions was, why does breathing work so well as a calming strategy? So, what happens when we're stressed is we stop breathing. We hold our breath. And so when we're stressed out, we actually aren't getting enough oxygen to our brain. So I don't know if any of you have ever like taken a deep gasp well, the reason that we gasp like this is we're letting all of that air out because we weren't actually effectively breathing. So it changes our diaphragm. It keeps us tighter. It keeps our muscles tighter. We're not getting enough oxygen to our muscles and to our brain. And that's why breathing can help. It relaxes our whole central nervous system. Just taking deep breaths in and breaths out. And noticing, you know, the differences, like being conscious of that breathing can really help clear your mind and relax your body. So we're just gonna go to the last slide. Um, and so I did just address one question, and that was on the breathing. But we also want to just leave some extra time for questions, comments, and reflections. So I want to open it up. I did I did see a couple of different questions that I can answer right now. Is that okay? Is it or do you want to read them, Dawn?
No, I think that's fine. I saw that question about those who may not be coping well but think that they are, and
Mhm.
what might we offer to them. I thought that would be a great question to ask you ladies.
Oh, I didn't even see that question. That's a good one. Well, Karen.
Well, let me go ahead and repose it then. The question was, how can we offer support to loved ones who are not coping well but think that they are fine?
Yeah. Karen, do you want to go first? And then I've been talking a lot.
More than just acknowledgement. So I would be persistent in your support of that person, but also know that in good time, um, the help seeking will emerge. So help seeking isn't something that we can impose upon anyone, even when we see that there's a need. I would hope in your response, Tara, that you can include the lack of an end in sight. So, in terms of helping those around us to cope, usually we have some sort of closure with the traumatic experience that's happened, and we can push off and move on from there, saying that that's over now, let's start the growth process. With COVID-19, the persistent nature of it has really led to some longer term hardships that folks are experiencing. Or you've heard the term COVID fatigue. Those who might have been coping well for the first few months of the pandemic are starting to unravel, and their needs are emerging, but they might not see them. Can you speak to that point, Tara, about the length of the pandemic and how it relates to coping, and people, putting one foot in front of the other, but not seeing the need that they might need external help?
Yeah. Yeah. And I think that's really common with a lot of people, um, primarily because they're feeling like they have to continue to keep going, 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 because if they stop, and they might not even consciously know this. A lot of times we don't consciously recognize the toll that stress is taking on us. And through COVID, again, a lot of times people may not have that self insight or self awareness because they just don't, they just can't right now. They are like I have to get all of these things. I have to keep going. I have to stay strong. And they might not even consciously recognize that they're saying that to that, that's what's going on. As Karen mentioned with the natural disaster, it's acute. It happens, and then there's this recovery phase. With COVID, it's so different, because it's been going on for so long. And for a lot of people, it's overwhelmed our coping capacity. So, just taking a step back for ourselves and saying, hey, how am I doing and what can I do? Recognizing that this is going on for a long time. In terms of others with that don't have that self insight, one thing that people don't always like is for you to tell them they're not coping well. They might say, "No, no, no, I'm fine," and they get angry about it. And so that's something you don't want to do. You don't want to say, "Hey, you know what? You're just not coping well at all." But you just lending an ear and not trying to give somebody the answers if they're having, if you notice that they're really stressed out. Saying, hey, there's a lot going on. Like if you ever want to take a step back, if you want somebody to talk to, I'm here. Um, and then also you can say, oh, you don't have to use this coping strategy, but I found mindfulness really great. And you can talk about how well it works for you. And if you talk about something that's working well for you, sometimes people become interested and they're like, oh, yeah, that's great. But you also don't want to overwhelm them if they're not interested at all. But you can provide these little blocks of advice through the back door. You don't have to say, this is what you should do. You can say, I do this and it works well for me. And this is a link I found. So, those are a few things you can do. But telling a person they're not, just saying, hey, you're not doing well. People don't tend to like that. So just putting little hints. It's like putting little pieces of the cookie out and saying, okay, little crumbles and saying, these are some things you can do. Or I talked to somebody and that was really helpful. Or saying, if you want to ever talk to somebody, I'm here to listen. So those are just some suggestions that might be helpful.
No,
Can
I
I
think
just
that
say one more thing for that?
certainly, certainly.
Like this had me thinking, your response, Tara, about the population that I work closely with. So birthing people and parenting people who are postpartum, they may or may not have other children in the home. And we think about disparities, our mental health disparities are really hitting gendered females harder than other groups. This could be loss of income, doing e-learning, having loss of childcare, and all of these other situations where you feel like you can't take the time to have the self-care, or you're so caught up in getting through the day, you don't notice. So I'd say for, the person who's trying to acknowledge the coping strategies for someone else, the best thing would just be to acknowledge it at a minimum. So
Okay.
I've heard from countless women that they didn't know something was wrong. They didn't see it themselves. It came from the outside. Like a friend said, have you ever heard about postpartum, hinting to postpartum depression? And it opened up a conversation
Yeah.
for someone who didn't know that they had any needs. So saying something is a start. The next start would be being supportive so they can make maybe a telehealth counseling appointment if they're lucky to get in, or make any other sort of appointment. Maybe it's the 30-minute mindfulness app.
Yeah.
But being there in a supportive way. So.
Yeah, no, Karen, you bring up a good point. Yeah, it's how you approach it. So, providing psychoeducation, like, have you ever heard about, postpartum depression? Yes, but going to somebody and saying you're not doing well, they don't like that. So it's definitely all about framing. But yeah,
Isn't it often it's how you deliver the message
yeah.
sometimes rather than the message? I know we're close to out of time, but I
Oh, yeah.
do want to get in one more question because I've seen it several times. And that was, are there any books that you would recommend for therapists or for individuals who are looking to learn more about post-disaster recovery?
So, there are a number of books. Well, my special, well, well, there are a few. I was going to say my specialization originally was in children with complex trauma. And so there is a book called The Body Keeps the Score by Bessel van der Kolk. It is amazing. And that's really gets deep into the mental health and how the brain reacts. It's really, really fabulous. And it provides this deep insight on how we can heal, not just through our conscious cognitive level, but how do we relax our overall nervous center, so our lower levels of the brain, and this can be through yoga, through breathing. But he gives this, it's just such a phenomenal book. I have another book here, and I'll bring it out because I'm actually teaching a class this semester. Um, so I'm glad. So this is a really simple book. I'm actually using it in my class. I don't know if you can see it. It's called Disaster Mental Health Interventions, its core principles and practices. So it just gives, it's by Halpern and Vermeulen, and it gives you the basics. It gives you the overview of mental health interventions and the stages of disasters, which is really interesting. How do people react? What are the interventions that you can use? And then there's also a lot of really great resources on, and this is for adults too, but the National Child Traumatic Stress Network. If you're interested in getting a deeper understanding of that, the mental health supports. So those are all more technical academic resources, but really can be really great and provide a lot of good information.
Oh, thank you so much. I know that we're close to out of time, and that was a lot of information to cover, but I certainly appreciate you sharing the self-care plan and taking the opportunity to ground us at the beginning. And I think a takeaway for me is just forgetting how powerful taking a few deep breaths can be. So thank you both so much for sharing your expertise and taking the time to provide us with some strategies to put into place. Um, I would like to also thank everyone who joined us today for our first program. We will be offering a second program in the mental health series, talking more about the research behind loneliness and what the brain is actually exhibiting, and that will be in 3 weeks on March 22nd. We also require our viewers to give us feedback so that we can offer programs that will meet your needs. So please feel free to contact us at c2st.cnf.io to offer an evaluation. You may also go to c2st.org to learn more about the organization and the programs that we offer, like this one, and to also support future programs and to sign up for our newsletter. So again, Dr. Powell, Dr. Tab, thank you so much for joining us today. We appreciate your time, and to everyone else, we wish you to stay safe.
Bye, everyone.
Bye. Thank
Thanks.
you.
Thank you.